Deciding on a facelift or any sort of facial rejuvenation treatment can be difficult. Before we decide on whether you would like to have a facelift or not, it's important to know what a facelift actually is. A facelift is a very generic term which people generally understand as a lift of the face to make you look more refreshed or youthful. The way this is done can be a range of methods. Some clinicians may offer you non-surgical methods such as Botox and fillers. However, this is generally considered as a temporary form of a lift, and we are going to focus on the surgical facelift. Our face is made up of many layers, which with maturity and age becomes lax. The surgical facelift aims to reposition these layers to produce a more rejuvenated look. Simply speaking, these layers include the muscle layer, also known as the SMAS layer, and the skin layer. The surgery will separate these layers and lift them individually in particular directions to help improve the look. Then comes a question, which part of the face is lifted to provide this rejuvenated look? This will depend on your consultation with me. I'll take photographs and I will ask you to bring some photographs of what you'd look like maybe 10 to 15 years ago, and together we'll decide which aspect of the face we can lift that you would benefit from. Each facelift is different, so the facelift that your friend or colleague may have had is different to what I will advise you to have. So it's important not to compare yourself to any other person. We may decide to focus on the lower part of the face and neck, and maybe the eyes, or we may decide to focus on the mid-face only, and this depends on your needs. Before surgery, we need to discuss preparation of the skin and yourself beforehand. So how do we improve the quality of the skin? How do we improve the fine lines and the texture? Although to a certain extent the lines will be improved by the facelift when we stretch the skin out, but only to a certain extent. We need to do lots of things beforehand to help with the surgery. First of all, lifestyle changes. Number one, stop smoking. This is key. Those who are smokers tend to have significantly poor quality skin, and if you are going through any form of surgery, even if it's non-surgical, you have a significantly high risk of infections and wound breakdowns, so it's best to stop smoking. I advise people to stop smoking 2 months before the surgery, stay off the cigarettes at least 2 months after the surgery also. Drink lots of water. There are lots of lotions and potions out there that tell you you can hydrate your skin, which is all good, but the best way to really hydrate your skin is simply to drink water. Exercise is incredibly important to get the blood flowing, to get all your antioxidants activated to help with the skin replenishment, and all round is good for you. Weight control. Fluctuating weight is also negative when it comes to any form of surgery, particularly cosmetic on any part of the body. If you have surgery and then you suddenly lose a significant amount of weight, this will make your skin lax again, so can negate the effects of the facelift. So it's important to reach a healthy level weight that you are able to maintain and stay at. Don't say that you will lose the weight after the surgery. This will have negative effects, particularly on the facelift. There are lots of things that you can also do to improve the quality of skin in terms of serums. There are 3 key ingredients that I would recommend, and I would advise use SPF every day. Make it part of your skin regime. This will help prevent any further damage to the skin. Retinol. Retinol has been clinically proven to improve the fine lines of the face. If you've never used retinol before, do a test patch on your skin beforehand. Some people react to retinol, causing some skin irritation. Make sure you start off with a low percentage, apply it at night and hydrate well. And when you do start using it, you'll notice you'll develop a tolerance. Increase your usage to 2 to 3 times a week, and then further as your normal night routine. Vitamin C. Vitamin C is also a very useful product that helps with antioxidants, and again is one of the few ingredients that exist that have been clinically proven to improve the skin. There are many serums out there that contain these ingredients. I'll be able to guide you and help you decide which products to use specifically in facial rejuvenation treatment. Other things that you may want to think about using is LED light therapy. Again, studies have shown this can improve the quality of the skin, particularly the fine lines. I will talk about these details in a different video. These are preparations that I would recommend for you to continue indefinitely. Let's talk a little bit more about the surgical plan. This will be a decision we both make together and will be dependent on a few factors. You may decide you want to have everything done in one go, or the surgery may need to be phased. This is dependent on the severity and laxity of the quality of the skin, or your desire to have a more conservative or a discreet effect. Severity and laxity. The principles of the surgery is to provide you a rejuvenated look without limiting movement or looking stretched. However, in some cases, despite achieving this, due to multiple factors such as mature skin or poor elasticity, you may need a second surgery under local anaesthetic to further tighten the skin or tidy up the scar. This second procedure or phase usually takes place after a year of surgery to make sure everything has settled. Some people may want a more conservative approach, a discreet approach with minimal downtime, so we may decide to do smaller procedures before the larger facelift to assess the response of surgery and deciding whether the facelift is really for you. This may be removing excess skin above the eyelids, which can be done under local anaesthetic. You may feel this is enough for you to help with your confidence and achieve the rejuvenated look you desire, or you may feel you like something further doing. You may, of course, want only one general anaesthetic procedure and are able to commit to the 4-week downtime and have a full facelift in one go, provided you are suitable. Even when you have everything done in one go, after a year, some people may need secondary surgery under local anaesthetic to tidy up the scars and correct any minor differences between the sides. Whether you have everything done in one go or phased, it is important to be aware of the fact that a facelift procedure is not a magic procedure that lasts forever. You need to maintain your skin, a healthy lifestyle, and you may need other minor surgical procedures to maintain the lift in the years to come. After the surgery, you will be completely bandaged up. This dressing will need to stay intact for a full week. During this time, avoid any heavy lifting or bending over. If you do need to bend, bend at the knees, keeping your head up. It's important to have a soft diet a week after the surgery. Sleep slightly more upright. You may get some ooze on the dressing which can become stained. This usually stops, however, it may be persistent over the first 24 hours. Apply gentle pressure over the area for 10 minutes and it should stop. If you do have any problems with this, contact us and we'll be able to guide you. In the first week, just relax. Start using the retinol and vitamin C 3 days after surgery and 5 days after restart the light therapy mask. This needs to be 10 minutes a day, twice a day for 2 weeks. When you return to us in clinic after the first week, we will clean your hair and change your bandage. At this stage, we will change the bandage, which needs to stay on for a further 7 days. After this, we will change you to a removable bandage to be worn day and night for 2 weeks, only taken off after a shower and replacing. You will be very swollen, you will be bruised, and you will be numb in certain areas, particularly underneath the chin and potentially the earlobe. Hopefully your recovery period is uneventful, but if there are issues, contact us. 3 weeks after surgery. I would advise you to wear a face bandage at night for a further 2 weeks. At 3 weeks after surgery, you will have a bit of a lumpy scar, particularly behind the ears. If you find that you are building your activity, this can cause your face to swell. Reapply the bandage at night. You may feel some stitches through the skin and the scars are a bit red. The surface is generally healed with the occasional lump, and a few of you may have small patches that require a small dressing. You will still be swollen and you can feel a hard or even a bit solid underneath the chin. You will still feel the numbness and abnormal sensation. This is definitely not the final results. The bruising signs may still be there. Continue with the light therapy and retinol every day for 10 minutes. As with every surgical procedure, there are risks, and it's important to be aware and understand of these facts before you have surgery. You will have a consent form that you need to sign, and this video will help you understand the consent form. And if you need to ask any further questions, contact my PA and I'll be able to answer them. Infection. All surgery has a risk of infection. We will give you antibiotics on the day of surgery. The signs of infection are redness and swelling, and if this happens, we will manage this accordingly. Bleeding. This can occur in the early stages depending on how much this is. We will treat this accordingly. A very small number of people need to go back to theatre. Swelling. This is common with most, if not all, surgeries, and with the face surgery, the swelling may concentrate on the lower part of the face. In the initial instance, for the first 7 days, you need to sleep upright on a couple of extra pillows or a V pillow. You need to avoid bending over and heavy lifting for the first 2 weeks. This will help maintain or reduce the swelling. The swelling can take many months to settle, and if you are having a fat graft, the swelling can be significant, but this does settle down. Asymmetry. No one is perfectly symmetrical, and after the surgery, there is always a risk of asymmetry. Most of the time, this is considered to be within normal limits, but I will assess you and intervene if required. Lumpiness. With scarring and muscle swelling, as well as fat grafting, you may notice some lumpiness. This does settle with time and massage. Pain. There may be some pain, however, if you are also having a neck lift, you will get throat pain. It will be difficult to swallow for the first week. Avoid solid foods during this time, and it will settle with time. You may get some pain along the scar. Discoloration. Old blood may clot underneath the skin, giving a bruised or discolored appearance. It will go away on its own, but massaging the area may speed up the process. Scarring. Scars will be designed to be as hidden as possible and placed in crevices of the face. They should fade with time, and you can buy creams and oils designed to improve the appearance of the scars. They can sometimes become red and lumpy and need massage and occasionally steroid treatment. Slow healing. If you are fit and healthy, you should heal. However, people who are smokers and have a history of diabetes and other comorbidities may take longer to heal. They are also higher risk of infection. Loss of feeling. It's likely you will get some numbness in the earlobes and abnormal sensation in parts of the skin. For some, this can be permanent. However, for most, it does improve with time. Nerve injury. There are multiple nerves in the face, including the facial nerve and the marginal mandibular nerve. In some situations, this can be injured or swelling can affect the nerves. If this happens, you will be followed up, and usually it settles with time. If there is nerve injury, your care may need to be transferred to the Norfolk and Norwich Hospital. This is extremely rare. Asymmetry or bulges. On occasion, some people may have slight prominences due to other areas of the neck. This is due to salivary glands or a muscle known as a digastric muscle. They may become more obvious as the overlying skin is tightened and these structures become more apparent. In some situations, the lumps in the neck may also be due to recurrence or laxity of the neck muscles again. I will reassess you and decide whether you need to have further skin tightening of this muscle. Secondary surgery. The procedure changes the position of the skin and the muscle layer by lifting. It does not change the quality of the skin. This will need to be maintained after the surgery, and we will advise you to do facial exercises after the surgery. After the surgery, the main surgery, you need smaller areas of skin excision at a later date to fine-tune the surgery or maintain the lift for the future. Long-term results. The facelift lasts many years. However, the natural aging process will always take over and you will need maintenance down the line. This does depend on the quality of the skin and how things are maintained. Thank you very much for staying till the end of the video, and I hope they're informative. If you have any suggestions or would like any further information, please contact my PA and we'll be able to answer your questions as best we can.